Well, as part of the Lesko Health, what I did is put together a special report for every state where you could find all the government subsidized programs and nonprofit subsidized programs to get healthcare for free or for very little cost. And then also dental care and even pet care. But here's something I found today in the New York Times. Look at this title here. A Mexican hospital, an American surgeon, and a check for $5,000. Now, this program is not in my report. This is a private company thing that insurance company does. In other words, if you choose to have this lady in the article, she's getting a knee replacement done in Mexico, they give her a $5,000 check. And she stays in Mexico for like a week and a half for recuperation too. I mean, she works in a factory in Wisconsin, and their healthcare coverage, what they found out, they could pay a third of the price for a knee replacement as it would be done in the United States. And what they do here's the key, that they send a doctor from the Mayo Clinic trained doctor down there to do it. So they fly down, and the doctor gets like $2,700, and he'd only get like a third of that if he was doing it in the United States. So the doctor's getting more money, and actually the amount of money they pay is like a third, I think, of what it was for. Let me see. Normally a knee replacement would be $30,000. Here it costs $12,000. Now that's the average $30,000, so it could be up to $50,000. So here in Mexico, it's only $12,000. Now what this company also did was cover extra insurance if you want to sue these people. Because you have an American doctor now, so you get a hold of us by the collar and grab him to court if you really want to. And so they did that, and plus you get an American surgeon, and he gets a nice little vacation too. And then you get a check for $5,000 because they're saving so much money. In other words, if you chose to have it done in the United States, they'd have to pay at least $30,000, maybe $40,000. They're only paying $12,000. So they're saving $20,000, $30,000. So that's why they could give you a check for $5,000. And they're trying to encourage, because there's some stigma that people have, and rightfully so. They should think twice about it. But to me, what it's showing is that, the kinds of things, I mean, I don't know the answer to healthcare. I know, number one, though, I know two things about healthcare. We pay twice as much for healthcare than anybody else in the world, and get worse results. People don't live as long, more deaths, all this kind of stuff. So it doesn't even prove that this is better health, because we're paying twice as much as everybody else. And we still have millions of people that aren't covered. And that's why if you're a member of Lesko Help, I show you where all the existing programs, because there's about a third of the people that are not covered under a private plan somewhere, or are covered by one of these programs, that the government already has set up, but nobody knows about it. See, that's the other thing about Google. If you're looking for healthcare coverage, you're not going to, you go Google, for hip replacement or fill in a cavity for free. You're never going to see the free stuff, because the free stuff doesn't advertise to Google. So if they're not advertising, that means Google decides, the robots at Google decide, right, what you're going to see when you put in a search. And why, they don't have a big motive to put in the links for you to see that if you click on those links, they don't get paid. They want to give you links where they get paid when you click on them, right? So they're the people who advertise on Google, not the people who don't advertise on Google. That's why all these free sources that I'm going to show you don't advertise on Google. That's why they're so hard to find. So that's why what I do is create the one source in America where you could find just websites that give you money. Here's $5,000. Give you money instead of websites that want to take your money. And that's what, I guess capitalism is all about, trying to get money from each other. But there's some things that are too important for that. But more importantly, people are going without the help or the whatever they need because they think it costs them a lot of money. And it doesn't. It just takes a little extra work and knowledge about the system. And that's what I'm trying to do. So if I can help you that way, that's the best way for me to do that is on Lesko Help. It's a closed Facebook group. And it's only $20 a month. Not like I'll refund your money. Don't worry about it. I just want to be happy and not be seen as somebody putting a mask on and a gun to your head and wanting your money. I certainly need money to keep going because otherwise I can't provide any service. So that's the key to money, and it's nice to see the people. That's why I don't want to charge a lot. I want to keep it as little as possible. Everybody's telling me, no, you got to charge $100 and 300, 400, 500, whatever you can get. And that's the basic of capitalism. You charge what you get. I don't. I think certain things you don't have to. There's certain media. How much money do you really need in life? I'll make a living, support myself and family. That's the important thing. And above that, I want to do something I think is of value. That's why I want to help other people find that. And I think you can. There's so many options out there for you to find things to do in life that are needed and get paid to do that. And it's a trial and error. There's no magic, button to press or 7 steps to follow. No, you got to design this yourself through trial and error. But most of all, know about your options so you can start trying them and failing. Because the more you fail, the closer you're going to get. It's simple. But as long as you're not spending a lot of money to do it, then you'll last longer to stay there until you find out what it is. Okay? So $5,000 they give you for having an operation. They're not selling your innards.